So I'm actually from Texas, from the DFW Metroplex area, and that's where I went to medical school. I did my internship in Oklahoma, and then actually did the rest of my residency here in Wilmington. And then I went to back to Texas to practice, and I was there for about 5 years, and I just missed the beach and missed the outdoors. You know, having been a resident here and knowing what a great city this is, it was a real drive to pull back when the opportunity came up. I've always wanted to be a doctor. I didn't know what kind to start with, but I always knew that that's where I wanted to go. I like the hands-on with patients, and I like the medical challenges, and so I knew that was always where I wanted to end up somehow. And when I was going through all of my clinical rotations as a medical student, I really enjoyed the connection with OB/GYN. Delivering babies was just fantastic, and just being able to work with women for all different kind of issues. It was just a really special experience. And so once I did that, I knew this was it. This is what I want to do. Well, a lot of things it's real helpful to talk about, are there any certain expectations or things that they really want for this pregnancy or for the delivery process, and just kind of talk about that. In some point, when you're just a minute pregnant and you're feeling sick, that may not be the best time to talk about the delivery, finding out if there's anything that is particular they really want to have as a part of their pregnancy experience. And then other ways, basic concerns that we like to address with everyone is making sure that, as able and is safe, we like to encourage physical activity, just because that actually has been shown to help with some nausea in pregnancy as well, if you're able to stay active, and it just keeps you healthy. And a healthier person who's now going to be pushing for potentially 2 hours, that can be helpful too, versus if you haven't done any activity for 9 months, it's kind of a jolt to the system. There are a couple of main reasons people come to see us. One is just they're having problems with their cycles. For a lot of women who are or young women who are in their adolescence, you can have something called anovulatory bleeding, which gives you some really bad periods, and that can be periods that are coming every couple of weeks to only having a period every couple of months. And so that's something that's a real common problem that we see to try, okay, what do we need to do to start our evaluation of that and see what we need to do to treat that. Sometimes that can be looking at doing contraceptive options as well. But also, while we're talking about those other things, kind of laying down the foundation for still healthy lifestyle to say, okay, yeah, so well, how does incorporating, once you start doing regular pap smears, talking about, eating correctly, getting the appropriate amount of exercise, and even make decisions like not texting and driving, just healthy decisions all around that are good habits to lay when you're young that will translate to healthier adulthood. So as we get older, it kind of is the flip side of adolescence. Your periods can actually start giving you problems again as you get closer to menopause. And then once you're done with menopause and the periods are gone, then there are just different situations that arise from that. Whether that's paying attention to bone health, making sure that we're getting our calcium supplementation, and doing weight-bearing exercises to help with making sure that our bones are still in good shape as we get older. Staying physically active again, that's a real important thing to do within moderation, and of course as is safe. But that's kind of a concern for everyone. We all need to be in motion. I've got 2 great kids, 2 young kids, and so pretty much our weekends or time off I'm not working is really centered around them. So my husband and I and the kids really like being outdoors, which is, of course, one of the fantastic things about living in Wilmington with the beaches and then even the parks and the playgrounds. And we've got some great locations to go to here, but we really enjoy being outside, whether it's paddleboarding or just swimming, or like I said, walking around. Outdoor activities is a real pull for us to be here. I really, really love my job, and I feel very, very fortunate. Even if I'm having a bad day, I know once I get to work, it's great. Just seeing the patients, feeling like I'm able to accomplish something to help them through a problem. It's just such a privilege. To whether it's just comforting for a delivery, or even just a quick OB visit and saying, hey, everything's looking good, and we'll see you back next week. And I feel very lucky that I have this job and be able to do it.